So here we are, a little over 4 months into COVID-19. We've learned a lot over the last 4 months, and we've had a lot of frustrations over the last 4 months. We've gone from a 2-page policy on COVID-19 to today I believe it's about 20 to 25 pages of policy on COVID-19. We've learned a lot, and we've made a lot of changes. We've expected a lot. And our team has risen to the challenge. And I just have to say thank you. I am impressed. I am grateful for all of the hard work that you've put in to making sure that our residents stay safe. Not only am I thankful, but I hear it from our families. I think in the last 4 months, I've not had any family member express any complaint about how their loved one has been cared for. This is no credit to me. It's no credit to the COVID-19 task force, well, maybe a little bit, in the research that they've done and the efforts that they've put in making sure the policies are in place. But the credit goes to you, the team here at Fairview Haven. You've had to make a lot of changes. You've had to adapt to a lot of new and unusual practices. And I just thank you for doing that without any complaining, really, at least to me. We've implemented a new screening process that takes some time. We've implemented wearing face masks throughout your day. We've implemented social distancing of our residents. We've implemented non-communal dining, feeding residents in their room. We've implemented no visitors, meaning that visitors aren't allowed in the building. Then we started outdoor visits. All of these things have taken some time to figure out. All of these things have added an extra burden to somebody here on our team. So thank you for your efforts. Today I want to talk about a question that I often get from our family members and others within our community. That question is this: why is it that our employees can come and go as they please, can do whatever they want when they're not here at Fairview Haven, and yet we as family members who are taking every precaution we can to stay free of COVID can't come in to see our loved ones? It's a really good question, and it's a hard question to answer. But this is the answer that I give so that you can kind of understand. The state of Illinois deems each one of us, team members here at Fairview Haven, as essential healthcare professionals. We are essential to the care and the physical needs of our residents. And unfortunately, they don't deem family visits as an essential function. I'm not going to agree with that, but that's what the state of Illinois says. And that's the guideline we have to follow. And inevitably, the family member typically turns to, well, then why can employees go about and do whatever they want when they're not at work? And I tell them, I've encouraged my employees, our team, to practice safe guidelines that CDC has published, that the Illinois Department of Public Health has published. And I think that you would agree, I've sent many texts encouraging you to do that. I want to encourage you to continue that. There are a lot of sources out there of information about COVID. You can get information from Fox News, from CNN, from MSNBC, ABC, CBS, I don't know, do all those still exist? I don't know where you get your news from. I will say this: I believe that every news network publishes facts, publishes data that's accurate, but they all have an agenda, and they all put a spin on those facts to meet their agenda. I want to ask you to please, as you think about what you do outside of work, that you think about those that you serve, that you think about our residents, and that you love them as much outside of work as you do in the workplace. I want you to think about the CDC guidelines and the Illinois Department of Public Health guidelines, because that's who we have to follow. And I want you to think about whether or not you're meeting those guidelines in your everyday life. Let's think about masks. And I know mask is a very touchy subject here in Fairbury, Illinois right now. There's a good majority of people that believe they're ineffective, that believe that we shouldn't be mandated to wear them, that believe that it's wrong, or whatever your belief is, whatever the community's belief is. But for whatever reason here in Fairbury, Illinois, it's a touchy subject. And I just want to encourage you as the administrator here at Fairview Haven that we as a healthcare community, the major healthcare community in Fairbury, almost the only healthcare provider in Fairbury, I want to encourage you to set the example in this community. The mask isn't going to necessarily protect you from getting COVID. It's not going to necessarily prevent you from bringing COVID into this building, but it is going to prevent you from spreading COVID should you contract it. And that's the message we need to be sending to our community. We serve a very vulnerable population. They are high risk in many of the categories. And so we need to do everything we can to protect them. And one way we can protect them is by setting an example in the community. So I beg you, wear your mask. I know it's awkward. I'm often the only one with a mask where I'm at. But you know, if 170 or 180 employees of Fairview Haven chose to do the right thing, as I often tell our new employees, how many more will follow? I think it would be a lot. Because I think there's a lot of people in this community that care about others. In fact, I would say most of the people in this community care about others. Social distancing is also important. If you're going to gatherings, keep that distance. CDC says 6 feet. It's not too hard to do that. I know it's inconvenient. It's not always the nicest thing. But again, why do we do it? We do it to protect others. We do it to protect those that we serve. And so I want to just encourage you, set the example. Keep your distance. If people come close to you, ask them to back up and explain your reason, because you want to protect those that you serve. Avoid large gatherings. Again, I know that's inconvenient. I know it's not real nice. I know that we would all like to just go back to normal. Right now, we can't do that. You can listen to all the news stories that say COVID-19 is a hoax, but it's not. Livingston County has had new cases in the last couple weeks, a lot of new cases. And no, they haven't been too bad, thankfully, but there has been new cases. The state of Illinois is on the rise again. I personally know people that have experienced COVID-19. This is real. Maybe it's not as bad as it once was, but it's still real. It's still happening. And we still have a responsibility to protect our loved ones. Some have asked about vacation. Should we be foregoing our vacations that we had planned this summer? And I'm going to just say that to me is a personal decision that everyone has to make. I would encourage you to do some research on the area that you plan to vacation to. Does it have a high prevalence of COVID-19 in that area? If it does, I'm not going to tell you to stay home. But know that going into it. And make sure you're protecting yourself and others. Just because you're on vacation doesn't mean you put the mask away. Just because you're on vacation doesn't mean you ignore social distancing. It doesn't mean that you should go to large gatherings. Continue to avoid those when you go on vacation. Perhaps this is the year to go to a lake and just do some fishing alone. Perhaps this is a year to just hang out with your family at a rental house or something like that. And again, I'm not going to tell you where you can and cannot go. And I'm not going to tell you at this time, I don't know what tomorrow will bring, but at this time, there's no restrictions on travel here at Fairview Haven. My only plea is, please be careful. And please know what you're doing. And take the precautions necessary to protect you and, most importantly, to protect your residents. I'd like to talk a little bit about the races here in Fairbury. I'm not going to tell you whether you can or cannot go to the races. I'm not going to tell you what my opinion is of the races. I'm just going to simply tell you this. Be careful. I've had lots of family members, community members, employees, team members tell me that they're concerned about the races being open here in town. I believe this past weekend they said there was over 2,000 people there, all huddled together in the stands, breathing over each other, hooting and hollering, no mask. That's not a place that we as healthcare professionals should be. If you're in the stands and you're well over 6 feet away from everybody else, maybe have a mask on, that'd be the best. So, vacations, races, church, whatever it is that you're doing, I'm not going to tell you you can or cannot do it, but I'm going to ask you, I'm going to plead with you, be careful. You are serving a vulnerable population. Remember that in everything you do. Again, wearing a mask doesn't necessarily protect them, but it sets the example in this community that we live. Let's be that example. Let's protect our residents and be the example to the community that we ought to be as healthcare professionals. One other thing I want to bring up while I have your attention. I think we're getting lazy. I think we're getting a little bit sloppy in the way we handle ourselves here at Fairview Haven. We're asked to wear our masks whenever we're in resident areas, especially when we're in close contact with residents, when we're around other team members. I'm seeing us get sloppy. I'm seeing us get lazy. I'm often seeing the mask like this. That does no good. If I'm breathing, all those particles are still flowing out into the area that I'm sitting. This is not an acceptable way to wear a mask. The nose is still exposed. The mask is designed to cover the mouth and the nose. The reason is so that particles cannot escape from you and get out into the general public. Please wear your mask appropriately. Please remember to keep our residents socially distanced. Please remember to encourage your residents to wear a mask if they're out of their room. Please remember, if residents have visitors, to keep the visitors 6 feet away, to keep the visitor with their mask on. Please remember, no visitors in the building. Please remember, no windows open during window visits. COVID-19 is not over. We're in the midst of it. It could get bad. We're prepared. We have a plan. And I believe wholeheartedly that God will protect us and that all will be okay should we have an outbreak here at Fairview Haven. But in the meantime, we've got to protect ourselves. We've got to take the steps that we're called to take to protect these residents. Thank you again for all you do. We have a wonderful team of caregivers. We have a wonderful team all around here at Fairview Haven. I feel blessed to serve as your administrator. I'm here if you have questions, if you need anything, and thank you for listening.